Hello. It is about 5 o'clock on Tuesday. I'm home from my 5th infusion. It was an interesting one. A lot of some issues. I'll just explain. I'll just say that and I'll explain them. Got up this morning early, got out of the house, got the girls to their grandparents, and grabbed some coffee, and then I got to the hospital. Paul had to drop me off, of course, because he's not allowed in the waiting rooms or anything right now. He should be able to go to my surgery though. But how did this all start? Okay, yeah, so blood draw went good. There was a student who did the blood, and she was just so nervous. Like, I don't think she's ever poked someone before. Like, she was just so slow and hesitant. But she did great, and it didn't hurt, and I didn't feel a thing, and they got in the blood. It just was difficult, like, for her to muster the courage to, she did the butterfly blood draw thing because of where she had to take it from. And I was a little nervous at first, but, there was someone with her, and she did a great job. But that was fine. Not complaining about that at all. Went to my infusion. It was at Mott's again, not at the cancer center. And very nice. I got a private room with a bed this time. That was awesome. Like, not even just curtains, like another private room. The nurse that first came in, she was great, and she had ended up going on lunch, but she did mention, but she asked me a question. She said, "Did you take your steroids this morning? Do you need your steroids here in your IV?" And I said, "I did take my steroids today. I always take my steroids because it tells me I'm supposed to. It's the day before, day up, day after." And I said, "But they always give them to me here." And she said, "Well, let me double check." And then she looked at my notes and she said, "No, the notes clearly say that if you did not have your steroids at home, then you get an IV steroid." No one has ever, to my knowledge, asked me if I've taken my medicine, and so I've been getting more than double the amount of steroids on infusion days. And these steroids are causing issues, and causing some extra side effects and some withdrawal symptoms, as I've explained. And so I said, "Well, that's really interesting." I said, "Well, let's not do it and let's see how I feel." And she's like, "Yeah." And so I did plan on bringing it up to my doctor, because that's a mistake. That's giving me medication that's not necessary, and just a simple question, and it's clearly in my chart. And so it's a little bit frustrating. I know that everyone makes mistakes, no one's perfect, but it's just that I've had the same nurse 3 of my 5 infusions, and there was another mistake she's been making, which I'll explain in just a minute. So anyways, so I did not get extra steroids today. And so I take 32 milligrams of steroids on the day before, day of, and day after chemo. When I get there, they've been giving me another 48 in my IV. And so that's there's just too much. And so I did get confirmation that it's not going to hurt me, but I don't know, it's just kind of frustrating. Nurse was able to get my IV. Sorry, I'm a little tired. My nurse was able to get my IV pretty quickly. And it was just a little painful, and she put it in a spot where I've had it done the last 2 times, or last time, and the time before it was a area where the whole vein was kind of blown out, and so it's a weak area. But it was fine. She, they gave me all the pre-meds in there and saline, and then did my Taxterol medication, which runs for an hour, and it was fine. No, a little discomfort, but nothing concerning, and I did bring it up. And then they go to switch to do my carboplatinum, and it's a 30-minute IV, and it started burning a little more, and I then after 10 minutes I looked down, and I have this huge hive, I don't know, 3 inches from the IV site, on the other side of the tapes. They tape it all down. And so I immediately called the nurse. 3 or 4 nurses came in and each looked at it, and then one of them stopped the IV, or stopped the chemotherapy so they could figure it out. And then my nurse came in, and she someone said that they recently had someone else, and it's like kind of weird that it happened, and it's just like one hive, and it didn't leak or anything like that, but they think it's my veins are just very weak, was having a bad reaction, and just like the not able to kind of like function properly. And so they took out that IV, and then they moved it to a different area and then finished. And I just had like 20 minutes, and they like monitored it very well. And my hive, as soon as they stopped the IV, the hive like went down, and now it's like barely there. I would say that the first site where I got the IV is very tender and blue and bruised and like raised. So I'm gonna keep an eye on it, but the hive is gone and no other problems when they gave it to the other one. And I mean, I'm so close to being done. They only can use one arm. There's only certain spots they could go, and so my veins are just kind of getting weak and like less and less. And I only have one more to go, you know, and so it'll be okay. But that was fine. Okay, so then they go to give me my Fesco shot. And like I said, I've been at Mott's twice, and both times I've been at Mott's, the nurses put it in the side of my like upper thigh, like on the outside in like the more the fatty part of my leg. And it doesn't hurt when they do that. And the first time I said, oh, that doesn't hurt when you do that. She's like, well, it shouldn't hurt too much. And I said, well, when I get it out of the cancer center, it hurts. And she's like, well, they need to go over here. I'm like, okay. So, you know, the same nurse I've had, I hate to complain, but like, you know, you have to like advocate for yourself, and you have to speak up, and you have to get like the right medication, because this Fesco shot is super important and really good for this type of cancer that I have, and is like necessary to fight along with the chemo. And so it needs to be administered like the proper way. So today when my nurse at Mott's again gave me the shot on the side, I said, are you like, when you guys do it there, it doesn't hurt? And she's like, well, where else would you get it? And I said, well, the nurse at the cancer center has been giving it to me like up here. Another thing I will say, this shot is like a newer shot, like in the last year or 6 months or something. It used to be administered in an IV like the rest of the chemo drugs, but now it can be administered in a shot form. It's one that takes 5 minutes to like slowly inject. So, I mean, it is new, I get that. And she said, well, it clearly says it needs to go, and she explained, I forgot what it's called, but like the area, and it goes in the fat part of your muscle, of your leg. And my other nurse has been doing in the top, like the very top of like my upper thigh, and right in the muscle, and it hurts so bad. And so I always have to have her like slow down and like we like walk through it, but it does, it's painful. And she said, no, that's not the correct way. And she said, keep asking questions like this, because she was remembering the steroid thing. And she said, you know, there's nothing wrong with you asking or telling them, you know, what you understand, and slowing things down. And if you need to even call one of her, ask her to check with someone, she's like, you should do that. So that was also again really concerning, because this is like a really important, how much does this drug cost? This is crazy. This particular shot that I'm getting every 3 weeks for a year, right now is costing like $36,000 per injection. It's expensive. It needs to be administered the right way. So frustrating. Yep. So then the last thing they did, sorry, I keep putting my hand over here, is they did give me my Neulasta injection. That went fine. This Neulasta injection is $15,000, and I have one more of these. It's so crazy. Each time I have chemo, it's around $55,000, and like majority of it is that injection and this patch. Like when I look at all the charges, and it's just crazy. So my insurance does cover it, you know. We've already met our deductible, even just like having our baby. And so, and we've just reached our out-of-pocket max. I don't even understand deductible. If you're gonna have to, like, why do they even say you have like a $4,000 deductible if you're gonna have to pay like $7,000 for your out-of-pocket? I don't get it. I get it. There are like things that change a little with co-insurance, but it's still just confusing. And I don't know, it's a lot of money. Anyways, left, Paul picked me up, grabbed lunch, got home, ate, and then I messaged my oncologist about these issues, because I just felt like I needed to like kind of like just follow through. And so her nurse got back with me and says she's gonna check with pharmacy about the way that the Fesco is administered, and another oncologist, just to make sure that it is as effective when it was administered in the muscle and not the fat. And she said she's bothered by the steroid issue, and it's nothing that like is bad for me, except for it could have made my side effects worse. And she's gonna like check in with like the charge nurse and make sure that the nurses are educated on like that. Like that's a simple question you need to ask, like, did you take your medicine this morning? It's like in my charts that I'm on this medication. So yeah, just a little frustrating, I guess. Let me think what else. Came home, fell asleep on the couch, then went to the bedroom, fell asleep, and Paul left to get the girls. He came in and checked with me. He's mad about these things. Like he's like fired up about them. Yeah, so that's it. Everything, I felt pretty good today. Like I kind of feel on the chemo days like I'm an athlete getting ready for like an event or something. I don't know how to describe it, but I am just like ready to like power through and get through the day and have a good attitude. And like, you know, like I said, I do have some anxiety like surrounding sometimes the like over the weekend. It's just kind of like, oh, I'm not gonna feel good, blah blah blah. But then like when it comes like time to go, I am packed, I'm ready, I'm fueled. I'm like just like ready to get it over with. And I'm so excited. I just have one more chemo, you know, and then lots of other things, but just one more chemo. Monday I did meet with my oncologist over the video chat. Yesterday was Monday, and talked about, you know, just things. We did talked about the issue with what she thinks might be heartburn and I think might be gallbladder. And I said, you know, what if it is gallbladder? And she's like, well, it could be. And she said that, but she's not gonna take out or have my gallbladder taken out right now. So she's like, even if it was, you have gallstones and this is a gallbladder issue, we're not gonna do anything until like, we're not gonna give you another surgery, even though that is like a minor surgery. She's like, so I could do a, what'd she say? She's like, I could do a ultrasound, but it's likely we're not gonna do anything. So we're just gonna see if we can medicate. She's like, all I'm gonna do is make, you know, try to like give you these medications like we're already doing. And so just to keep her updated, because I have had like a total of four attacks, and 2 of them were very, very bad. Like, and when I do get them, I get them for hours and hours. And so, and sometimes they seem to be related to what I eat, and other times, like a couple times I had a completely empty stomach and was getting ready to eat like dinner when this happened. And if I did have a gallstone, it could be like from my pregnancy, and that she said the chemo wouldn't like cause these gallstones, but the chemo could like affect, because it affects your whole like tract and stuff, from what I understand. This is all new to me. Yeah, I think that is it. I will try to make little short videos the rest of the week and kind of put it together like I have been. Yeah, that's it. Thank you. Alright, so I'll try to talk loud because I'm outside and it is raining, and I want to make sure you can hear me. I know my audio isn't always the best, or I talk quiet. So today's Wednesday, about 4:30, and Paul just left to go pick up Charlotte. Abby's napping. She's napping really good today. And I just took a shower because my new last armband was finished going off at 4, so I jumped in the shower after once I take it off. And now I'm just sitting outside doing this quick update. I was really looking forward to coming outside because it was going to be hot. Because like before I got in the shower, it wasn't raining. It's been raining a lot today, but before I got in the shower, it like looked like it was warm outside. I was like, I should go out there and just get some fresh air. And then I come out here, I'm like, oh, it is completely downpour, but I'm under the porch. I feel pretty good today. Pretty normal for a Wednesday, maybe slightly better, which is nice. Rested all day, didn't try to like to do much. I haven't even like touched laundry or dishes, and which is hard for me not to do, but I didn't do it. I just took care of Abby, watched some TV, and took a nap. Now I'm gonna go inside. I'm gonna prep some dinner, and Paul will finish it up. And then Paul we were talking about he's going to pick me up ice cream, but it's kind of gross out, so I don't really know if I want that anymore. But yeah, there is our Wednesday update. I'm doing good. I'm hoping that the right dosage of steroids is gonna like just kind of make this round easier. That'd be nice. Okay, so it is Friday, late afternoon. I did not record yesterday. Yesterday and today have been rough. Just completely out of it. On the couch, taking naps. Both girls were yesterday and today went to grandma's house. And today actually I went for hydration. Normally I go on Monday, but with it being the holiday weekend and they just weren't able to find enough beds or chairs for Monday, and so they did it today, which is Friday. So at 12:30 I went in and got 2 liters of hydration, and I think I feel better. Today was pretty bad. I felt just very weak and out of it. I feel much better now. Still kind of just out of it. It's a really nasty rainy day out today. Kind of gross. Really am missing the girls. They're gonna come home tonight. Paul's gonna go get them soon, and that'll be really nice. Yeah. You know, normally I get hydration later on in this process, and so I'm really hoping this makes me feel better for the weekend. Tomorrow's Saturday, and usually I feel much better on Saturday, so I'm looking forward to waking up tomorrow. Overnight last night was rough. It was just like, I just wake up every few hours and it's like I feel paralyzed. It's weird. It's like I'm awake, but I can't really move. It sounds so weird. It's not that bad. Yep, but we're almost done with this round. We're getting real close. All right, so final update for this round 5. Today's Saturday evening, about 8 o'clock. I just got Abby to bed, and Paul's getting Charlotte to bed, and yeah, so just kind of like normal, similar pattern. This morning I woke up feeling a lot better. I haven't been sleeping good. I actually was up quite a bit the last 3 nights, and so I'm gonna try and take some medicine tonight that might help me sleep and just get like a solid, good chunk of sleep, and that should make me feel better. But I woke up just feeling so much better, clear-headed, could like think, not feeling overwhelmed. Awful stomach problems all day, no appetite still, but like I could deal with that. I feel mentally, I feel here and there, and I can like have a conversation. And it was so weird, like even Paul reminded me earlier, we did hydration yesterday, and it was really rainy, and like even the rain was like overwhelming for me. Like I couldn't, it was just like too much, and everyone having conversations in the lobby of the hospital was like a lot, and it's a strange feeling. But like normal, I woke up this morning so feeling so much better and hungry. I woke up at like 4 and had some oatmeal, and then I still couldn't go back to bed, so around 6 I got up and like started making breakfast and visited Paul, and like we like both just started crying when we saw each other because he just could like tell that I felt better. And it's just really emotional, and it's not perfect, like I threw up today. I've had stomach problems today, didn't really have an appetite, but like I'm like here and I can deal with it, and I have a little more energy. Tried to take a nap. I couldn't take a nap today, so I'm hoping I can take a nap tonight or go to bed and sleep good tonight. But overall, I feel good. I think this is where I'm gonna end this video. I mean, I don't think anything should come of it. I could go to hydration on Tuesday, but it's in Brighton. It's not till 4, and I don't think I'm gonna need it. I'm just gonna, because I did get hydration yesterday. I'm just gonna try to deal. Looking forward to this week. Paul has some days off. We have a couple things planned, so it should be a good week. So thank you everyone for praying and keeping up with me and all the encouragement and everything. I really, I do enjoy it. So thank you.